Hello and assalamu alaikum, dear guests, and welcome to another episode of Hello Doctor. I'm your host, Dr. Akil Jaigida, and every week we bring a special guest on this show to talk about the importance of good health in the South Asian community. And this is a show that you can call in and ask all the questions you have, because every week we choose a special topic with an expert guest. And today's topic is on dental care, something that we probably all neglect, including myself, and that's why I've got an astounded guest with me today. And whilst we ask him all about dentistry and the importance of good oral hygiene and mouth care, before I do that, just a bit of a disclaimer. Remember, this isn't a show to call in if you have an acute medical need. If you do, call in 999-111 or attend your local emergency service. Now that the disclaimer is over, let's go back to the show. So as mentioned, today's show is on oral hygiene, and I have with you a very special guest with a number of accolades under his belt. Dr. Zain Hamid, how are you?
Hi, assalamu alaikum. Thank you so much for having me today. I'm honoured to be here to discuss dentistry. Just to reinforce again, I'm here representing myself to have a general discussion about dentistry.
Perfect. Just a bit of a bio about Dr. Zain Hamid. So Zain qualified in dentistry from King's College London in 2019. Having also completed a degree in biomedical sciences, he has worked within general practice, hospitals, and is currently undertaking a fellowship role with NHS England. He has enjoyed treating high needs practice patients of all ages, supporting NHS 111 services during COVID and managing trauma, severe dental infections, and performing oral surgery as part of dental core training. Outside of clinical work, Zain is passionate about outreach, regularly participating in career events and working with Health Education England to help train other healthcare professions to become more effective educators. Now that we've done with the bio, Zain, I can, for one, say that I thought dentistry and mouth care wasn't as important until I had really bad back of the tooth pain, the molar pain. And since having that pain and going to a dentist for the first time in my life, since childhood, let's say, in my adult life, the pain that was relieved straight after that, honestly, I think we both know who the doctor was at the time because he worked at King's College.
Sure.
But I went to him and I said, brother, you are my best friend right now. Because the pain I had was excruciating. And I went back to him and he said, no worries, I'll look into it. And within an hour, the pain was gone.
Okay, amazing.
Yeah. So probably from my side, I can answer this question. But from your side, why is mouth care important?
So like you said, oral hygiene can encompass many things. So it's about not just the teeth health, the tooth health, but also the gums as well. And oral hygiene is important because we only have one set of adult teeth. So from the age of about 12 onwards, you've got your adult teeth for life. So it's important that we maintain them for the next 60, 70 years.
Sorry, from which age do you have your
So about 12 years old,
you
have the majority of your adult teeth. But you might have wisdom teeth as well, that come in when you're about 18 years old. Roughly then, it comes sometimes earlier, sometimes later. And when the teeth, when it, say for example, it gets pulled out or it gets decayed and needs coming up, it doesn't grow back. So we have to make sure that we look after the teeth so they last as long as possible. And in terms of obviously oral hygiene, that involves eating well, not doing any bad habits, say, and having a good diet, things like smoking, barn, those kind of things are going to affect your oral hygiene. So it's important that we keep our teeth clean, keep them healthy, so they last as long as possible, so they don't incur any decay, which can then lead to pain, lead to tooth loss as well, and that they last as long as possible, so they maintain the ability to eat, to live, to be confident, and as well as the fact that oral hygiene can also represent a preview almost into the body. So the state of the mouth can indicate what's going on further below. So for example, inflammation of the gums or severe gum disease can indicate diabetes. There can be a link between them. There's also been evidence that shows that poor oral hygiene can also influence rates of heart disease as well. So it's very important that we keep the mouth clean as it affects the rest of the body.
So the teeth can actually have an effect on the heart?
Yes,
Okay, that's something, you wouldn't put two and two together. I remember seeing a patient actually who had a heart condition and also, now remembering it, did have a dental issue as well. preview of how the body is inside. Why is it so neglected then?
I think the key is what we call putting the mouth back in the body. People treat their dental health separate to how they treat everything else. And a lot of the time people really go to the dentist possibly when they only have a toothache or a problem. But really we need to make sure that people are going regularly to their dentist as well. Yeah. And in terms of the teeth, again, people can become complacent possibly, or not realise the effect that a bad diet or bad habits can be having on their mouth and their teeth. The teeth, they're strong, but they can also be quite delicate in terms of maintaining a good balance of, say, the pHs in the mouth, keeping the mouth a good environment so that the teeth do not decay, or the gums do not start becoming inflamed and lead to gum disease.
Fantastic. So just back to the guests, dear viewers, then please do call in. We have an expert dentist. You might be, it's very sometimes hard to get a hold of the GP, let alone the dentist. So any problems with the teeth, or you want to talk about certain conditions, or any questions you may have, please call in. We will try our best to answer them to the best of our abilities, given that we have an expert in the field with us today. So going back, how did you end up in the field? Because I want to know a bit about you, Zain.
So essentially, what really crystallised it for me was work experience. At a time when I was doing GCSEs, I was in that crossroads of what I'm going to do for the rest of my life. And for me, dentistry was one of the options on the table. Medicine was also there. But to help clarify that decision, work experience really helped and give me like an informed choice what I wanted to do. So I did do work experience in a GP, and then after that experience in a dentist. And what I liked about the dental work experience was the teamwork. So the dentist was there, he's working with other dental team members, the nurse, the hygienist, the dental therapist. So a real skill mix was present. And he was also, I loved the relationship he had with his patients, the kind of the rapport that he built. And most of all, I think, was the ability to work with his hands. He was there doing treatment, can be quite basic to quite complex. So either doing an examination or a clean, to doing root canals, oral surgery, bridges and crowns. And that kind of variety of treatment offered, I found incredible. Further to that, the scope of career options within dentistry itself I also found very interesting. So people might think it's just teeth, but really you have things like oral surgery, taking out teeth. You have things like endodontics, doing root canals, orthodontics, doing braces. There's such variety within the dentistry itself. The option to teach dental public health is amazing. And the fact that I knew dentists there at the practice and the ones I've met since, you have a really nice kind of work-life balance and also variety in their work as well. So some days, 3 days might be in one practice, 2 days in another practice, or even 2 days in hospital, or 1 day teaching. So it really helps to break up the week and it keeps things interesting. And I think that's important to preventing burnout and just in facilitating the more ways that you can look after patients and give them care.
No, it's a fantastic answer. I'm going to go back and maybe ask very silly questions for someone of your level, but is teeth bone?
Teeth is not bone. Teeth are made out of enamel, which is like a mineral material. So it's not bone. Bone holds the teeth in place within your jaws, but the tooth material itself is not bone.
Okay, so we've got fact number 1 done.
Sure.
Going back, as a kid, I had to have braces. Is it purely aesthetic that you need braces, or is there other reasons why braces should be recommended?
No, braces, multiple reasons. So to help with chewing. If the teeth are misaligned, then your mouth, you find it difficult to chew things. At the same time, confidence. So how they arrange might affect your smile. Speech is always very important. People might struggle to speak because of the alignment of their teeth. Also, health-wise, in terms of breathing, people can sometimes have an open bite, and the open bite can affect how they breathe. And having braces, improving the bite, improving the arrangement of the teeth will help with breathing issues too.
So teeth can actually affect breathing?
Well, for example, so your breathing might not be as fluid.
You might have turbulent breathing.
Turbulent breathing, for example.
Okay, possibly. That makes sense.
Or you're not breathing, it's more mouth breathing as opposed to nasal breathing. And that's not good for, in terms of, say, how much oxygen you're taking. Or your development as a child. We encourage better breathing as well to help.
So is braces only good because everyone that I know, they got when they were during a child life or teenage life. Is it okay to have it during your adult life as well?
Of course, I had braces twice.
Oh, wow. Okay.
So I had them when I was 15 and again when I was 22.
Okay.
And I went one step further and had orthodontic surgery too, which is where they broke both my jaws and realigned them. And
oh, wow.
Yeah, so that experience really pushed me further into pursuing dentistry too.
Was that done by dentists?
It's done by dentists. A whole team of it. It's a multidisciplinary team.
Yeah.
So I had an orthodontist, I had a MaxFax surgeon. So I had people working together to make that happen.
I love the fact that you brought up I love the fact that you brought up MaxFax. We'll talk about that, but we have a caller on the line.
Oh, yeah?
Assalamu alaikum, caller. Can you hear me?
Assalamu alaikum. Assalamu alaikum.
Wa alaikum salam.
Walaikum salam.
আশা করি ভালো আছেন আপনারা
জি ভালো আছি, আপনি ভালো নেই?
আলহামদুলিল্লাহ আল্লাহর রহমতে। আচ্ছা, আমার একটা সমস্যা দাঁতো
জি
about 6 weeks হয়ে গেছে বুঝছেন না। তো আমার ও গাইলটা তো সমস্যা হইলো বেদনা, খুব বেদনা করে নিচর শারীর, কিন্তু উপরের শারীর সোজা যেটা নিচর শারীর বেদনা করে ওটা সিধা উপরের দাঁত বেদনা করিয়া আমার জো ইয়া ব্রেইনও যায়, আমি বুঝ পাই বেদনা করে। তো ডেন্টিস্টও গেছি, এক্সরে করিয়া কইছে যে আমি বেশি ব্রাশ করে লইছি, গামরে দেয়। তো সফট ব্রাশ দিয়ে ব্রাশ করতাম, অত ব্রাশ করতাম না। 6-7টা যদি আমি চেষ্টা করলাম, আমি সেন্সোডাইন ইউজ করি সব সময় বুঝছেন, আমার হোল লাইফ। আমি কমেন না, বুঝলাম না কি তা করতাম, একটু যদি অ্যাডভাইস করেন আমারে।
জি আচ্ছা, of course আমরা এটা আনসার দিব। জাস্ট আমি আন্ডারস্ট্যান্ড করতাম সাই কোশ্চেনে আপনার কোন সাইডে দাঁত বেদনা আছে, বামে ও ডাইনে? বামে। নিচে ও উপরে? নিচে দাঁতে বেদনা। এটা ওই আপনি ওই কইও এটা কি বেদনা অন্য ও আরো ফিসে বেদনা?
জি, আমার বেদনা যে নিচর শারীর যে দাঁত বেদনা করে, জি, ও দাঁত সোজা উপর দাঁত বেদনা করে, করিয়া ওটা আমার জো ইয়া ব্রেইনও বেদনা যায়। ও
হসপিটাল হচ্ছে আপনি বেশি জোরে দাঁত ব্রাশ করা, এইটা প্রবলেম? হসপিটাল না, ডেন্টিস্ট হচ্ছে। জি আচ্ছা,
ডেন্টিস্ট হইছে যে আমি বেশি জোরে বেশি ব্রাশ করে লইছি, বেশি ব্রাশ আসলে এই সময় যে সময় গেছিলাম এই সময় ও মানে আমার গামর মাঝে ইউ আছিল, সো আছিল। তো আমিও দেখছি এক্সরে করছে যে, তো ওখানে আর সো রয়েছে না, তারপরে ও বেদনা রয়েছে আর মাঝে মধ্যে ব্লাডও আয়।
ও আচ্ছা,
ব্রাশ করার সময়।
ওকে, আমি আস্ক করলাম। সো ওকে, অ্যাকচুয়ালি ওখানে আমরা আনসার দিতে পারতাম না, বিকজ ওখানে ব্রেকও টাইম হয়ে গেছে। বা আমি আমার গেস্টকে কইম ইনশাআল্লাহ, after the break I'll answer the question inshallah. Is that okay? Okay, we're going for a short break. See you very soon and we'll get back to that question ASAP. Thank you. Hello and assalamu alaikum, dear guests, and welcome to the second half of Hello Doctor. As we mentioned in the first half, today's show is on good oral hygiene, making sure that we keep our teeth clean and what happens if we don't, and ways we can look forward to going back to the dentist and not being scared of them, really. So, reintroducing my guest, I have Dr. Zain Hamid with us, a dentist. And just before the break, we had a question. We had a question from a viewer asking that he has pain at the back of the teeth, and this pain is now moving on to cause brain pain. And he's been advised to use a softer toothbrush. I've discussed it with Dr. Zain, and the answer. Do you want to go through the answers?
Yeah, sure. So just to clarify, in terms of brain pain, what Akil means is that it's spreading just along the side of the face, so the jaw up to the head. So not pain, hopefully, in the brain, but just on the outside, just along there. So the individual is having pain on the bottom teeth here, all right? And he's saying he's been advised for a soft toothbrush because he's brushing too hard. So what we recommend is when you have a soft toothbrush, make sure you read the packet that it is soft, firstly, number one. Number two, when brushing, make sure you angle the brush, if it's a manual brush, towards the gum. And then number three is use small circle movements. All right? Nothing abrasive like that.
So not this?
No.
Okay, fine.
But more small circles. Okay. All right? And support it with the manual brush to aim it towards the gum. All right? Because you need to clean food and debris away from the gum line as well as the teeth as well. Okay? So the side there, the top surface and the inside is important. All right. So this individual is having pain along here, spreading to the top jaw as well. And what could have happened is that, number one, he might have traumatized the area already because he's got a history of brushing too hard. If you brush too hard, you get what is called gum recession. So the gum recedes down the tooth, exposing the bottom kind of layer of the tooth, which is made of dentine. And that layer is quite sensitive.
Yeah.
You have small tubes which are quite exposed. And they can, when you have like something hot or cold or pressure, it can cause a lot of sensitivity in the area and pain in the tooth. Okay, so the individual said that when he brushes, it also bleeds, which again raises two questions. Either he's brushing too hard still, causing it to bleed, or he's not brushing enough. Because one thing that people may miss is that when they see bleeding gums, they tend to avoid it.
Yeah.
But problem is the bacteria, plaque, debris, food debris, it builds up. And it builds up in the gum where it's not being brushed, and it causes more inflammation, and you start bleeding even more. So the key is to brush not too hard, gently with a soft brush, clean the gum as well as the teeth, remove the debris, remove the inflammation, hopefully eliminate the bleeding.
Okay, fab.
Right.
So the advice in general is definitely make sure it's a soft brush. Check the label. Second point is, if it's bleeding, then our brush korono. But aste hore brush kota. So it's brush it softly, right?
Softly, yeah.
Yeah, and in circular motion. So not straight like this, circular.
Then angle downwards towards the gum.
And angle downwards towards the gum.
Yeah, like that. And then another thing, if it's sensitive and if it's prolonged sensitivity in the area, one thing you can do is use sensitive toothpaste.
Okay.
Right? And you can use that, you should use it twice a day. And it takes normally maybe a week to 2 weeks to start working. Yeah. Because the toothpaste has to build up within the tooth to then reduce the sensitivity.
Okay.
And then third option is to keep it in overnight.
Fine.
So take a small smear of toothpaste, rub it over the tooth surface and leave it there overnight.
Okay. So afne dato hoy bed na kore, take some toothpaste, little toothpaste, dato rako, as the right. So keep it throughout the night, the toothpaste on the teeth, and hopefully that should make your teeth more accustomed and
so it builds up like a protective layer.
Oh, builds up protection.
So within the teeth, it blocks the tubules, where water or cold may be going into, causing the sensitivity.
Fine.
All right?
Okay, inshallah.
And then one thing that may also be happening is that in between the teeth, food and debris might be being missed. Because obviously when you brush the teeth like this, you're brushing just one surface. But there's bits in between the teeth that may not be reached with a normal toothbrush, which is why we also recommend interproximal aids. So these aids clean in between the teeth. This is what you call a TP brush. So if I straighten that out. And this is used going in between the teeth, like this. Okay? So it cleans in between the teeth where the bristles of a brush might not be reaching. Also option is using floss. And again with floss you need to wrap it around the tooth, up and down, to remove food debris, not side to side.
Oh, wrap it around.
So wrap it down, say, not
Yeah.
completely around, but say in a C shape. Like here, I love to cover just this bit. I go up and down.
Okay.
And then hug this tooth in a C shape, up and down.
Okay, fine.
Yeah.
Doing a lasso around the tooth, basically.
Not the whole way around the tooth,
Yeah.
but just like a C shape. So you put the string through like that, and then you just put it like literally just a little bit C shape. hugging the back of the
I'm
tooth.
learning something new
And
as
then
well
up and
every single
down.
time on this show. We have another caller on the line. Assalamualaikum caller. Hello, Assalamualaikum.
ভাই আমার কথা শুনতে পাইলেন আপনি?
জি শুনতে পারলাম আমি।
জি ভাইয়া, আমার দাঁতও কোনো সমস্যা না এমনি।
জি।
আমার ওভার 50 আমার এজ, বাট কোনো প্রবলেম নাই। বাট গত কয়েকদিন ধরে আমি ঠান্ডা পানি খাইলে মানে খুব মানে কষ্ট হয়।
ওকে।
দাঁতর মাঝে নচেত করে ধরে আর কি।
ওকে। কোন সাইডে, বামে ও ডাইনে?
দুইও সাইডে দিই, কোনো বেদনাও নাই, কিছু নাই, কোনো সমস্যা আমার কোনোদিন দাঁত হয়েছে না।
জি।
বাট ও গত কিছুদিন ধরে 2-3 সপ্তাহ ধরে মানে ঠান্ডা পানি খাইলে খুব প্রবলেম করে।
আস্তা দাঁতো, সব দাঁতো।
জি জি জি।
ওকে, 2 weeks. আর গরম পানি?
গরম পানি কোনো প্রবলেম করে না।
গরম পানি না, জাস্ট ঠান্ডা পানি।
খালি ঠান্ডা পানি, কোল্ড ওয়াটার খাইলে মন সেট করে ধরে আর কি।
ওকে। ওকে, আপনি লাইনে থাকো।
জি।
So basically, the caller's calling in. He has usually no tooth pain.
Okay.
He's above 50.
Okay.
But for the last 2 weeks, when he drinks very cold water,
Okay.
he's getting pain everywhere.
Everywhere.
Yeah.
Okay.
But it's not there for hot water.
Just for cold water.
Just for cold water.
Okay.
Yeah.
Does he have any gum recession?
After gums healthy ni. Gums. Age aga.
জি।
Healthy. Yes, healthy.
Healthy. Has he tried sensitive toothpaste?
After কোন toothpaste use করো?
আমি আপনার কোলগেট ইউজ করো, কোনো কোনো সময় ডিফারেন্ট করি, ম্যাকমেলান করি, কোলগেট করি, তারপরে আরো কত জাত সব বদলাই আর কি সামটাইম।
G. So Colgate, Macmillan, he changes it regularly.
Okay.
Yeah.
So recommend possibly to use sensitive toothpaste.
Is there a certain brand that or
You can get just normal sensitive toothpaste.
sensitive toothpaste?
Yeah,
G. After toothpaste, a sensitive, make sure horo. Like, is it sensitive toothpaste?
For sensitive teeth.
Or for sensitive teeth. So next time, toothpaste or after they create a sensitive toothpaste ni.
জি আচ্ছা।
G. And anything else?
Anything else? So make sure he's using it twice a day and not to rinse the mouth with water after he's used toothpaste. This is something that we all should be doing, is spitting but not rinsing.
Oh, so you don't get water and you shouldn't
No,
wash it?
not at all.
Oh, okay. So, dino duba dat brush korba?
জি
G. Kulli hori na afne.
জি
জি আপনি জাস্ট ফানি ইউজ করো লাগে দাঁত ব্রাশ করে ফানি আছে না আমরা কুল্লি করি ফানি দিয়া আপনি ফানি দিয়ে কুল্লি করি না so I basically said after brushing the teeth you shouldn't rinse the mouth with water, you just spit.
Just spit out. Spit it all out, don't swallow it.
Yeah.
Spit as much as you can, but don't rinse with water.
Is this something that warrants that he should go to the dentist?
You can. Obviously, there's no harm. It's obviously recommended to see your dentist.
Yeah.
So if he's concerned, then yeah, definitely. If he's, it's causing trouble and it's a new thing, then definitely I think go to the dentist for an assessment.
Okay, so time being jonne apne sensitive toothpaste use korba. Dino duba dat brush korba. Kulli hori na apne. Ar bedna bondo hoise na then after dentist jaite hobe.
Yeah.
বেদনা করেন না, আমি তো এমনি মাউথ ওয়াশ ব্যবহার করি।
He uses mouthwash. Is that good or?
So with mouthwash is good.
Yeah.
But with that, again, it's key to use it at a different time than to the toothpaste. Okay, so you should wait half an hour after brushing before you use mouthwash.
Okay, so mouthwash apne adha ghonta bade dat brush bade use korta. Apne what time use koro mouthwash? Dino right ke?
আমি দিনও করি।
Dino kile dat brush shomoy koro ni apne?
জি দাঁত ব্রাশের লগে আমি টুথপেস্টের মধ্যে মাউথ ব্রাশ করি। আর 5 মিনিট আমি ওলা বই মানে কুল্লি করি না।
Oh, okay. Apne mouthwash half an hour bade use korba. Because eklogi use koro this. What happens when you use it together at the same time?
So if you use it at the same time, it's not as effective.
Oh, okay. So okay, half an hour after that brush, use the mouthwash half an hour after. And then that should hopefully make the protection, keep it strong and give the protection it
Yeah,
needs.
so you need the fluoride within the toothpaste to stay on the teeth. and that helps to protect the teeth and gums.
Oh, okay, fine. Hopefully that answers your question.
Okay, thank you.
You're welcome. So, going back to our questions, you mentioned we were talking about braces and everything. You mentioned MaxFax as well.
Yeah.
For those who don't know, the viewers, the younger population, if this is a profession that you're looking into, this is an incredibly difficult profession in terms of timeline. I think it's the longest profession from all professions. Or?
You need a dental and a medical degree.
Yeah. So you need a dentistry degree and a medical degree to become a MaxFax surgeon. I have a few close friends who are MaxFax surgeons, and I've seen them. They're running around like madmans and madwomen. They're working the medical life, and then they work in the dentistry life. Huge respects to them, because some of the things they do is absolutely incredible.
Yeah, life changing.
Yeah, it's life
changing. It changed my life. So.
Oh yes, yeah, you use them as well.
Yeah.
Fantastic to them. We have actually, before we even go to the next question, we're being bombarded with calls today, and that's good news, because I think a lot of people are having problems with their teeth. Assalamu alaikum, next caller.
We're here to help.
If you can, Assalamu alaikum caller, if you can, apna volume take to my bain, please. Turn off the TV volume, please.
Hello.
Ji, Assalamu alaikum.
Yeah, can you hear me?
Yeah, I can hear you.
Thank you very much. I got recently 11 fillings in my teeth. And what advice can you give, brother?
Which fillings did you get?
I got like fillings temporary.
Yeah. Okay, yeah. I'm going to leave it because Zain can answer this question better. If you want to answer, he's had some fillings. Feel free to.
Okay, so question is, you've had some temporary fillings done, or permanent fillings?
Some temporary filling and some permanent filling.
Okay.
And most recently, I got one crown filling. Sorry, what is called crown.
Yep.
So I need advice, like what you can give me advice in order to like as in terms of lifestyle, how can.
Oh, great. All right. So I'm glad to hear you've had some dental work done. That's good. In terms of looking after it now, the key obviously is brushing twice a day, as we've said, spitting the toothpaste but not rinsing with water, and then secondly is the dietary aspect. So in terms of diet, the key with your diet and sugar intake is frequency. All right. So in terms of frequency, what I mean by that is sugar more often is more worse for your teeth than having a lot of sugar in one go. Okay?
Yes.
Because what happens is snacking, essentially, you're taking in sugar in the mouth, and it's more often you have it, the more the sugar is in the mouth, and the more it's being broken down into acid. Okay, and that acid is what causes decay within the teeth and causes fillings to fail. Because they're being decayed around it, this is what causes problems. So people think that having a little bit of chocolate now, then a bit of fizzy drink after lunch, and a little bit of sweets or cake in the afternoon is fine because the quantity is small. But really, what we need to focus on is the frequency. Because you keep having sugar introduced into the mouth, it's maintaining that acidic environment, which is causing decay, causing the problems. So the key going forward, looking after everything, is, like I said, brushing twice a day, and in terms of your snacking, not reducing your snacking to no more than 4 times a day. Ideally, no snacking for bedtime either, and make sure you're brushing twice a day. With regards to your crown, it's very important you keep that clean, because again, you can't clean underneath the crown, so you need to clean all around it to prevent bacteria and decay happening underneath the crown. So as I was explaining earlier, things like the TP brush, which can be used, for example, if that tooth is a crown, so again, using it in between the crown itself, or using floss as well, to again keep all the margins of the crown clean to prevent it being decayed.
Okay, hopefully that answers. So in a nutshell, the advice is brushing your teeth twice a day.
Yeah.
Also keeping the area, the crown, clean as much as possible. And the main thing is the frequency. So this goes against being a medical doctor, but if you want good teeth, but maybe you want to put on a bit of weight, eat all your sugars in one go. And that way, if you eat the sugars all in one go, the movement of the sugars is happening only in one sitting. It's not happening repeatedly, and therefore-
Exactly. So the mouth is not being constantly challenged with sugar,
yeah.
and therefore acid is not being constantly produced. Have it in one go. The saliva in your mouth washes away that sugar and the acid eventually.
Yeah.
Okay, after say about amount of time. But if you keep introducing sugar, acid is constantly being produced by the bacteria, which then causes decay on the tooth surfaces.
Fantastic. And I think this here is a great investment. To be fair, I don't have one, but I'm going to get one.
Well, the TP brush.
The TP brush.
Yes.
If you don't have a TP brush, because to be fair, we only think about this brush. This brush isn't something that's always marketed or shown to us, but it looks like this has a lot of fundamental good effects on the teeth.
Because the teeth, especially say the ones at the bottom and the front, they're very close together.
Yeah.
And so it's hard for the bristles always to reach in between.
Yeah.
Same thing at the back. Again, the teeth are close together.
Yeah.
The bristles might not penetrate into the gaps between the teeth. That's why you need things like floss, TP brushes, to clean those areas in between where the toothbrush can't reach.
Yeah.
Yeah.
And I can repeat using these.
You can repeat using it. Eventually, the bristle might get old,
Yeah.
but you can get a packet of them with at least like 5 of them.
Yeah.
And you get different sizes too, depending on the size of the gaps in your mouth.
Fab.
So this is about middle of the range, I'd say.
Yeah.
You can get pink ones, which are small. You get different colours for different brands, but really, there's different sizes which are personal and appropriate for everyone.
Yeah. I think this is probably one of the most relevant topics we've done because it's such a neglected field. Oral hygiene, looking after your teeth is so neglected until you get toothache. The point you get toothache and then you understand what it is. I remember my toothache, I think it's the second worst pain after child delivery is infective pulpitis, is it? Or is that common?
I'll tell you something interesting. So when I was working in the hospital, I had a patient coming with a dental infection. And he was an army veteran. And he said to me he's been shot, he's been stabbed, he's broken bones. But no pain has been more painful than a toothache. Yeah. Even after going through all of that, he said the most pain he's ever experienced was a toothache.
Yeah.
So it shows, that we should be very vigilant, very adamant in keeping our teeth and mouth clean, and keeping our teeth clean because you want to avoid having that level of pain.
Definitely.
Really?
I think during COVID, my pain, I had like a temporary filling done. And I was on a night shift on trauma and orthopedics.
Yeah.
And the pain was horrendous to the point it was affecting, my function as at the time. So I just said, you know what, I need to take some time off right now. Called 111.
Yeah.
If you have any pain, call 111. Because they have an emergency dental service that you can get through. And how much is the appointments, by the way? Like if you're paying for it, I can't remember the top. I think it was £27 I paid. I went in, I explained the pain.
Yeah.
And they said, oh, we could do a root canal after this. And I said, no, just take it out. Okay. So I just got the tooth extracted.
All right.
And the relief I have following it is like, okay, now I need to look after all the other teeth. So it's important. It's such an important topic.
Yeah. And so just to correct what I said earlier too, right, seeing the dentist, we should be going to see the dentist regularly, not just when you have pain, but you should be going regularly.
Is there any guidelines of how often we should be going?
Yes, a very good question. How often you go depends on your individual circumstances in terms of your risk factor. So first thing is go to the dentist, they'll do an assessment and they'll look at your medical history, your dental history, your social history and your level of decay you have in the mouth at the time. And that will essentially determine your current level of risk factor for developing further decay or further gum disease.
Yeah.
And so once they've established what common level risk you are, high, medium or low risk patient, they'll then work with you to create a personalized kind of recall period.
Oh, okay.
So they say to you, okay, this is the amount of decay I found in your mouth and the amount of gum disease I found. This is kind of risk that I think you are, and this is when you should come back. So if this is all according to NICE recall guidelines. So if someone is high risk, then they might see the dentist every 3 to 4 months for the treatment. Someone is, say, not as high risk, could be 6 months. Someone is low risk, could be 1 year to 2 years before they have to revisit the dentist for another assessment.
Why are people so scared of the dentist?
Why are they so scared? So I think a lot of the scaredness might
because you're a nice guy and I would love to, have you as my dentist.
At any time.
But, but there's this thing where people are just so scared of dentists and going there. I think it's maybe the initial pain or something. Or
I think a lot of the times when I've experienced patients who are anxious, it might be due to previous bad experiences. I think a lot of the time they've had something as a child where either they weren't listened to by the dentist. That, you know, might be in pain or they wanted to stop, and the dentist might have just carried on. Or, you know, that's very rare. Or they just might be scared of the environment in terms of, you know, the drills and the sounds, that kind of thing. So it can really affect people long term when they've had bad experience with dentists before.
Yeah.
The dentist might have done everything right, you know, at the time, but again, the patient might have found it uncomfortable or painful as a child, which has then stayed with them. So how we overcome those kind of patients is just acclimatization. So what I mean by that is getting them used to being at the dentist, being used to the environment. Same thing we do with children, is that the first time they come to see us, you know, we're getting them used to being at a dentist. So we'll show them the instruments, show them the lights, you know, we'll show them the mirror more than the instruments, and, you know, we'll make them nice and relaxed and comfortable just to be there, be in that space. We won't even do any treatment. And then the next time they come back, we'll do something nice and straightforward and simple, like putting on fluoride on the teeth, you know, or give them a little clean or something. And then after that, we might do treatment, so filling. And it's the same with adult patients who are anxious. So again,
we actually have another call on the line.
Sure.
And we only have 6 minutes left of the show. So let's take this caller. Assalamualaikum, caller.
Walaikum salam. Can I talk Bengali, please?
Yes, please.
Basically, আমরা কিছুদিন আগে আমি একটা ব্লাড টেস্ট দিছিলাম বুঝছেন নে
জি
দেওয়ার বাদে আমার জিপে হইলো আমার রক্ত সম্ভব কোন মানে লিক করা কি
রক্ত কি করা লিক করা
মানে ব্লাড কি ইনসাইড হলো সামনে লিকিং হইলো ব্লাড মানে তখন বাদে আবার টেস্ট হওয়ার বাদে মানে লাস্ট উইক গেছিলাম আর কি
জি
যাওয়ার বাদে মানে হয় মানে এটা না এটা ঠিক আছে বাট একটা হয় আমার হইলো রিসেন্টলি তুমি আফ্রিকান কান্ট্রি বা বাংলাদেশও গেছিলাম হইলাম না
জি
তে হইলো যে তোমার কাছে ও একটা মানে কিটাকে স্ট্রংলি লয়েড একটা ডিজিজ হইলো
স্ট্রংগিলয়েড ডিজিজ
ইয়ে
আচ্ছা সো এটা কোনো এটা ডাটার সমস্যা না আজকে আপনার
জি না
আচ্ছা এটা একটু ডিফিকাল্ট কোয়েশ্চন হয়ে গেছে লাইভ অন এয়ার এটা আনসার করতে একটু প্রবলেম হবে আপনার নাম্বার দিলাম ডেস্কো দেন আমি আপনাকে একটা ফোন দিতে পারবো বা আজকে শো জাস্ট ডাটার সমস্যার জন্য Is that okay? If you call back on the line, leave your number and then I'll try to get a call with you sometime after the show. But at the moment, today's show is just for problems with the teeth and inshallah we can answer that so we can fully maximize Dr. Zain's presence here tonight.
All right.
Okay.
Stay on the line and then you can put through someone.
Yeah. If you call back and then just give your number and then that should be okay. Okay?
All right. Thank you.
Okay, assalamualaikum. So that was a caller asking for something different, but we want to fully maximize your time, Dr. Zain.
Sure.
So going back, there's a lot of aesthetic work that's going on in dentistry, teeth whitening. Is teeth whitening healthy for the teeth or is that more just looking good?
Well, in terms of teeth whitening, as long as it's done safely, that's the key. So what I mean by that is going to a qualified dental professional, make sure so that, you know, they're GDC registered, they're following all the protocols and the standards. That's where people should get their teeth whitening done. You know, because I've seen other avenues, say online, where you can get teeth whitening done. The people who might not be registered or regulated properly. So teeth whitening is perfectly safe as long as you get it done with the dentist.
Yeah.
Okay. So in terms of safety, the dentist will assess you and then decide whether your case is suitable to have teeth whitening in the first place.
Okay.
But the ones offered in NHS or within dental practices, teeth whitening there, those are ones that are usually safe. It's the ones outside of dental practice that you don't see a dentist for, you know, a dental professional, then those aren't, you know, recommended.
Fine, that makes total sense. There's guidelines for a reason, and as you mentioned NICE guidelines, and then there's GDC guidelines and GMC guidelines. Meeting those guidelines as a professional is our top priority,
Of course.
Because that's how we maintain patient safety.
Certainly, patients come first.
Yeah, because we only have a few minutes left. Is there a message that you want to get through to the viewers today? Is there a myth that you want to debunk? Or is there something that you want to reiterate at all?
So I think one thing that we have to be worried about, also within the South Asian community too, is habits. So things like smoking, things like pan chewing.
Yeah.
These things are very bad for your health. Okay, so not just your overall health, but especially your mouth as well. So things like smoking and pan, like betel nut, they can increase the risk of oral cancer. Okay, and The key is to not, I think, cut those habits out as much as possible.
Yeah, I say this every week to our viewers. I'm going to keep on saying it because whatever topic we've talking about, pun keeps on coming out. Fun, zodda, shufari keeps on coming up. If you're doing it, let's stop it or let's limit it. You can't stop stuff straight away. I do understand and I do respect that. But making an active effort trying to stop it, making an active effort to say, you know, instead of having it 4 times a day, I'm going to bring it down to 2 times a day. This has a great effect with your overall health. And it's like climbing a mountain or running a marathon. You won't see the effect straight away, but you'll see it eventually. Fun, we think, is, you know, sometimes traditionally acceptable, but it does have an effect, like Dr. Zain said. It increases the chance of mouth cancer, and we don't want that to happen. We want to. This is a show to make sure that we keep you nice and healthy. But this is the gist of today. I just got a message that was unfortunately the end of today's show. We've had so many lovely questions come in and so many lovely answers from yourself, Dr. Zain. Thank you so much for being here today. The pleasure is all ours, and hopefully after today's session we will look after our teeth so much better. I know I personally will. So thank you for everything you've done so far. But yes, tune in for another episode of Hello Doctor next Sunday. See you then. Assalamu alaikum.
Alaikum.